All right, today we're talking about a really effective antibiotic that comes with one single non-negotiable rule. The drug is metronidazole, and its motto is pretty straightforward. Kill the germs, but absolutely positively skip the alcohol.
So, to really get how metronidazole works, you first have to understand the very specific problem it's designed to solve. It all comes down to a special kind of germ that loves to hang out where others can't. So, what in the world are these low-oxygen germs?
Think of these guys as specialists. They've figured out how to thrive deep inside your body in places where there's hardly any oxygen. And because they're so unique, you need a unique kind of weapon to go after them. And that right there is where metronidazole steps in.
So let's properly introduce our main topic. What exactly is this medication that's so perfectly tailored for these tricky environments?
Well, metronidazole is kind of like a two-for-one deal. It's an antibiotic that goes after what we call anaerobic bacteria, and it's also an antiprotozoal, which means it can fight certain single-celled parasites. You'll see doctors prescribe it for some very specific infections like bacterial vaginosis, trichomoniasis, and amoebiasis. It's a specialized tool for a very specialized job.
So how does this drug actually pull it off? How does it take out these highly specialized germs? Well, the mechanism is actually pretty clever.
It's really a simple three-step process. First, the drug gets inside the germ. But here's the genius part. At this point, it's totally inactive, kind of like a secret agent waiting for a signal. It only gets activated inside the low-oxygen environment of the germ itself. And once it's activated, it gets to work shredding the germ's DNA, which makes it impossible for it to survive or multiply. It's like having a special key that only works to break the engine from the inside.
Okay, so we know what it is and we know how it works. Now for maybe the most practical part of all, how to use it safely. And don't worry, we've got a super simple way for you to remember all the key points.
It's so easy. To keep all the safety info straight, just think of the word Metro. Yep, that's it. Let's break down what each of those letters stands for.
First up, M is for microbe target. This is just a quick refresher of what we just covered. Metronidazole is made specifically for those anaerobic bacteria and some protozoa. It's definitely not your everyday general-purpose antibiotic. Okay, now E is for ethanol, which is just the scientific name for alcohol. And listen, if you only remember one thing from this entire explainer, please make it this one. You have to avoid alcohol while you're taking it and for at least 3 full days after your very last dose. If you mix them, you can get a really nasty reaction. I'm talking flushing, horrible cramps, nausea, vomiting, headaches. It happens because your body just can't process the alcohol while this drug is in your system.
That's right, 3. A minimum of 3 days. That number is not a suggestion. It's non-negotiable for your safety.
Next, we have T for taste and tummy. This is where you need to know the difference between something that's common and something that's a red flag. It's pretty common to get a weird metallic taste in your mouth, or maybe some nausea or an upset stomach. These are usually manageable and not something to panic about. But you've got to be aware of the other side of the coin, the rare but urgent symptoms. So while that metallic taste is common, things you see on the right, like nerve problems, that pins and needles or tingling feeling, or a serious rash, those are definite red flags. And that's when you have to take action.
And that brings us perfectly to R for red flags and risks. Let me be perfectly clear. If you start to experience any of those urgent symptoms we just saw, the tingling, any weakness, a bad rash, or any confusion, don't wait it out. You need to get medical help right away.
And finally, O is for other interactions. Because it's not just alcohol you need to think about. Metronidazole can interact with a bunch of other drugs, which is why it is absolutely critical that you tell your doctor about everything you're taking. And I mean everything, even supplements. Here are just 3 big examples. It can actually boost the effect of the blood thinner warfarin, which increases your risk of bleeding. It can also cause the levels of lithium in your body to spike, and it should never ever be combined with a drug called disulfiram because of a potentially dangerous reaction. The bottom line here is just keep your healthcare team in the loop about everything.
All right, let's move on to the single most important rule when you're taking any antibiotic, and that for sure includes this one. This right here is the golden rule. You have got to finish the entire course of medication exactly as it was prescribed. I know, it's so tempting to stop when you start feeling better after a couple of days, but the infection might not be totally gone. Stopping early just gives the toughest germs a chance to survive and come back even stronger.
So, let's just recap with a few simple everyday tips. 1. Finish the full course. 2. Don't stop early just because you feel like it. And 3, always give your dentist or surgeon a heads up that you're taking it before you have any kind of procedure done.
To wrap things up, let's do a little rapid-fire round and answer a few common questions that people often have about this medication.
Okay, first question. Can it make your urine darker? Yep, it can, and this is usually totally harmless. Next, is it safe to take during pregnancy? That is a decision that you and your clinician need to make together. And finally, a big one. Can you just take a leftover pill if you feel a little off? The answer is an absolute no. You should only use this medication when it's prescribed by a doctor for a specific diagnosed infection.
So, after all that, what's the bottom line? It's really this. Metronidazole offers targeted help for the right kind of germs. And the most important thing for you to remember is to pair that help with a hard no to alcohol until you're well in the clear.
And I'll leave you with this question to think about. When you take the time to really understand your medication, not just what it does, but how it works and why the rules are there, how does that empower you to take a more active role in your own health journey? And one last, very important reminder, this explainer is for learning purposes only. It is not and should not be a substitute for professional medical advice. Always, always consult your own healthcare provider for any medical concerns you have.